You may have heard the term mini stroke before, but do you truly understand how serious it can be? Did you know that 1 in 3 people who experience a mini stroke will go on to suffer a major stroke afterward? It's a deeply concerning statistic, but also a hopeful one. Up to 80% of strokes can be prevented if early signs, like a mini stroke, are recognized and treated in time. And yet each year in the United States, more than 240,000 people experience these silent warning signs without realizing how serious they are. Many brush them off as just a strange off day, only to face devastating consequences when it's too late. So, what exactly is a mini stroke? In medical terms, it's called a transient ischemic attack, or TIA. Transient means temporary, and ischemic refers to a lack of blood flow. In simple terms, a TIA is a brief interruption in blood supply to a specific part of the brain, like a key pipeline getting blocked for a short moment. This blockage is often caused by a small blood clot or a narrowed artery that restricts blood flow. Unlike a major stroke where the blockage lasts long enough to cause permanent damage to brain cells, a TIA is temporary. The clot may dissolve, or the body may quickly redirect blood flow around the blockage. As a result, the symptoms only last a short time, often just a few minutes, and by medical definition, never more than 24 hours. Afterward, the person usually feels completely normal again. But here's what you must remember. Temporary does not mean harmless. A TIA is not a minor issue to overlook, it's a loud and clear warning from your body. Think of it like a fire drill before the real fire breaks out. It means something is wrong, like a growing blood clot or severe plaque buildup in your arteries, and you're at serious risk for a full-blown stroke that could cause irreversible damage. In fact, the highest risk for a major stroke is within just days or weeks after a TIA. That's why recognizing the signs early and getting checked by a medical professional right away is absolutely critical. It could mean the difference between recovery and tragedy. In today's video, we'll explore 10 key signs and characteristics of a mini stroke. Some of these are fairly obvious, while others are subtle and often overlooked, especially in adults between the ages of 60 and 80, when many changes are mistakenly seen as just a normal part of aging. Being able to correctly identify these warning signs can help you respond quickly and appropriately. So let's get started. The first 2 points we'll cover are not specific symptoms, but rather common characteristics of a TIA, factors that often cause people to delay seeking medical help, putting them at greater risk for a full-blown stroke. 1. Symptoms often mistaken for something else like aging. Stress or lack of sleep. Many signs of a TIA are easily misunderstood as common health complaints or simply brushed off as temporary discomfort that gets blamed on just getting older. For example, a sudden dizzy spell might be chalked up to mild dehydration. A brief moment of confusion or forgetfulness. Must be my age. Unexplained fatigue. Maybe I just didn't sleep well last night. The key difference lies in how the symptom appears suddenly and out of the ordinary for your usual health. If something feels completely off, it shouldn't be ignored. Tell your doctor about it, and if the symptom comes on abruptly and feels severe, don't hesitate to call emergency services right away. Now let's take a closer look at the more specific symptoms. Keep in mind that any of the following signs, especially when they happen suddenly, could be a warning that a TIA is occurring. 2. Sudden confusion or difficulty. Understanding language. This sign involves your overall cognitive ability. You might suddenly feel mentally foggy and unable to think clearly. Familiar places may seem strange, or you might have trouble recognizing close family or friends. This acute confusion, sometimes called delirium in medical terms, happens when blood flow to the frontal and temporal lobes of the brain is interrupted. This sudden change in your mental state is serious and different from your normal thinking ability. 3. Sudden dizziness or loss of balance. This isn't just a mild, lightheaded feeling, it's a sudden, often intense sensation. You might experience true vertigo, feeling like you or the room is spinning wildly. Or you could suddenly lose your balance, becoming unsteady, prone to falling, or unable to walk in a straight line, called gait ataxia. The cerebellum and brainstem play crucial roles in coordinating movement and maintaining balance. When a TIA disrupts blood flow to these areas, your sense of balance can be seriously affected, especially dangerous for older adults who are at higher risk of falls. 4. Sudden severe headache. Often called the worst headache of your life. This is a type of headache you must never ignore. It comes on very quickly and intensely, like a lightning strike out of a clear sky. Many patients describe it as the worst headache of my life, with pain that spikes within seconds or minutes. The strain on blood vessels during a TIA can cause a headache known as a sentinel headache, which serves as an early warning signal of a serious risk ahead. 5. Temporary loss of consciousness or feeling lightheaded. Presyncope. This can be very alarming, a sudden brief loss of consciousness or a sensation of dizziness and lightheadedness, like you're about to faint. Medically, if you don't fully lose consciousness, it's called a presyncopal episode presyncope. If you do faint, it's called syncope. Loss of consciousness or presyncope, related to a TIA, occurs when blood flow to the reticular activating system in the brainstem is temporarily interrupted. These episodes usually last only a few seconds, but serve as a very important warning sign. 6. Symptoms that appear suddenly and then disappear, but still a critical warning sign. This is perhaps the most easily misunderstood and dangerous feature of a TIA. Symptoms often come on unexpectedly. You may feel completely fine one moment, then suddenly realize something is wrong. But just as quickly as they appear, these signs vanish. Within minutes, or sometimes up to 1 or 2 hours, you might find yourself back to normal. This rapid disappearance can create a false sense of security, making you think, "Oh, it was nothing. I'm fine now." But that's not the case. This brief window of symptoms is a crucial warning from your brain. It's a valuable chance to act before a severe, possibly irreversible stroke occurs. Never ignore symptoms just because they go away. 7. Sudden trouble speaking or slurred speech. Aphasia or dysarthria. This is one of the classic signs of a stroke or TIA. The areas of the brain responsible for language need a steady supply of oxygen-rich blood to work properly. When this supply is briefly interrupted during a TIA, your ability to communicate can be affected instantly. You might experience aphasia difficulty, finding the right words, using the wrong words, struggling to form clear sentences, or not understanding what others are saying. Another form is dysarthria, which causes speech to become slurred, slow, or garbled. The key factor is that these symptoms come on suddenly. 8. Sudden weakness or numbness. Usually on one side of the body. This is one of the most noticeable signs of a stroke or TIA, sudden weakness or paralysis, often affecting only one side of the body. This can happen in the face, arm, or leg. The motor cortex in the brain controls muscle movement. When blood flow to one side of this area is interrupted, it affects the opposite side of your body. You might suddenly notice your face drooping when you smile, or one arm becoming weak and losing strength. The fact that these symptoms affect just one side is a very important warning sign. 99. Sudden and temporary changes in vision. Symptoms can vary widely. You might suddenly experience blurry vision or double vision diplopia. A particularly serious sign is temporary vision loss in one eye. Amaurosis fugax, often described as a curtain slowly descending over your field of vision. Some people may lose part of their vision in both eyes at the same time. Homonymous hemianopia, or see flashing lights scintillating scotoma. These visual disturbances happen because the occipital lobe, the brain's center for processing images, is not receiving enough blood flow. 10. Sudden tingling or itching sensation. Paresthesia, usually on one side of the body. In medical terms, this is called paresthesia. It happens when blood flow to the part of the brain that processes body sensations, the sensory cortex, is temporarily interrupted. Like many other TIA symptoms, this sensation typically affects only one side of the body. You might feel it starting at your fingertips and moving up your arm or from your toes and traveling upward along your leg. In summary, here are the 10 important signs and characteristics to remember symptoms that come and go. Signs easily confused with other health issues, sudden trouble speaking or understanding speech, sudden confusion, weakness or numbness on one side of the body, sudden dizziness or loss of balance, temporary changes in vision, sudden severe headaches, sudden tingling sensations, and brief loss of consciousness or feeling lightheaded. If you or someone around you shows any of these signs, remember the FACET. Rule F. Face drooping. Ask the person to smile. Does one side of the face droop? A arm weakness. Ask them to raise both arms. Does one arm drift downward? SUT. Speech difficulty. Ask them to say a simple sentence. Is their speech slurred or strange? T. Time to call 911. If you see any of these signs, call 911 or your local emergency number immediately. Every second counts. During a stroke, brain cells die rapidly, so the sooner medical care begins, the better the chance of recovery and less brain damage. Time is your brain. Don't wait to see if symptoms go away on their own, and don't try to drive or take the person to the hospital yourself. Call emergency services right away. They can start treatment and save lives on the way. Besides knowing the signs, it's important to be aware of common risk factors for TIA and stroke, especially for people aged 60 to 80. These include high blood pressure, diabetes, smoking, high cholesterol, atrial fibrillation, and irregular heartbeat history of TIA or stroke, and family history of stroke. Managing these risk factors well is a key step to preventing stroke. Recognizing a TIA is the first and most important step to preventing a more serious stroke. These 10 signs and symptoms are urgent warning signals your body, or the body of a loved one, is sending. Pay attention and listen closely. For those in their 60s, 70s, or 80s, taking charge of your health and knowing these signs isn't about fear, it's about empowering yourself. This is how you give yourself the best chance to live longer, healthier, and maintain your independence. Please share this video with your friends and family, especially those in this age group or anyone caring for older adults. This knowledge could save lives. If you found this information helpful, please hit the like button. That helps more people see it. Don't forget to subscribe and turn on notifications so you won't miss our upcoming important health videos. We'd also love to hear your thoughts, questions, or experiences in the comments below. Your sharing can be very valuable to the community. Thank you for spending time with us today. Stay alert, keep learning, and most importantly, take proactive steps to protect your health and that of your loved ones. See you in the next video.